Okay, let me know if you guys can see. Okay, so are you ready, Mincho? So I'm gonna put the station on after this, and you'll have 2 minutes of reading time. And once that 2 minutes gets over, we'll start the session for 8 minutes. Okay, and at that point, I'll change back to our Microsoft Teams screen so I can see your face while doing the consultation. Okay, I'll start your timer now. Glad that you're back. So, have you read the station?
Yes, I have read it.
Okay, so I will restart it. I'll restart your 8 minute timer now.
Okay.
Okay, 3, 2, 1, start.
Okay.
Hi, hi, doctor. I just came after the nurse told me about that the results are back for Joshua. Can you tell me what's happened?
So, hello. I know you're Joshua's parents. So, I am the treating doctor who is working in the hospital here, who is seeing your son.
Okay,
Uh, so, do you have an idea of what your son has or what your son is diagnosed with?
I have no idea. I know that the doctors have done quite a lot of blood tests and other tests, but we haven't really been given a clear explanation about what's happening.
Okay. So, first, let me explain to you what has happened to your son. So, since the tests, like you told, the doctors have done, so we have run all the tests, and since your boy has presented with all the fatigue symptoms and fever and bruising, so we have done a biopsy. We noted that he has some like childhood congenital condition which is associated with the lymph node. So we have done a biopsy of the bone marrow and molecular testing, and we have noted to have that your child has AML, which is called as acute myeloid leukemia, which usually occurs in children.
Okay,
So this condition is it is a condition where it can be treated at we have started treating, but your child is poorly responding to all the treatments we have been giving, and we have a poor response which is coming up. So first is that. Did you understand, and do you have any further questions or any doubts regarding it?
wait. So you started treating Joshua already, and he
Mm,
hasn't been responding.
mm.
What does that mean? Like, is he going to be okay?
Okay, so like we told, your child is going is not responding good to the treatments we have been giving him. So we wanted you to know that there are many possibilities of outcomes which can come to has to your child. Uh,
Okay. What exactly have you given him as treatment?
okay, we give chemotherapy drugs and to these patients.
What do you mean these patients? And
That
chemotherapy? Like chemotherapy, you mentioned chemotherapy. Isn't that something that doctors usually give patients who've got cancer? Are
yeah.
you telling me Joshua has cancer?
Yeah, he has a lymphoma. So yeah, he has
Is it
leukemia.
is it
It
is
is
it leuke what is it?
it
Is
is
it
leukemia.
leukemia or is it cancer?
It is leukemia where his WBC counts are very low, where his body is not able to fight all his infections, and his body's immunity is going down. Uh, so yeah,
Okay. Oh my God. You that was quite a heavy. Sorry. I wasn't expecting this.
Mm. You don't have to cry. I know this is a sudden news, but
No, I'm feeling really upset, doctor. And
okay.
so, how long does Joshua have to live?
So yeah, I think usually people get to live 5 years of age when they are diagnosed with this condition with good improvement and treatment. So we'll try our level best to give him good care and treatment in our hospital. You don't have to feel bad. I know it's
Are
a
you,
very hard time for you.
are you telling me that Joshua only has 5 years to live?
Uh,
He was just a few weeks ago, he was perfectly okay. We just come back from our family trip.
yeah,
I
I
don't know
understand.
what I'm gonna do.
Yes, I
I,
understand.
I, I shouldn't have brought Joshua here. You guys have not been taking care of him. I know I've come a lot of times before and no one's updated me about anything, and now you're just telling me that he's got cancer and he's got 5 years to live. How do you expect me to take this, doctor?
No, that is not the case. Actually, we get a lot of patients like this, and we have done all the investigations that is
Oh,
required and given him good treatment.
what are you? You're just being so impolite and you're being so impersonal when you're talking about Joshua and you're referring him as some patient. I am extremely disappointed. I can't, put my feelings into words. You have no idea what's going on with me, doctor.
No, that's not the case. We care for all patients and all kids the same way. As you're worried about your kids, and as doctors, we too worry about our patients in giving them the good treatment. It's just sometimes some people respond good and some people don't respond well. So it is one of the poor outcomes your child has had, and I completely understand your pain and your
No,
worry
you
and
don't. No,
frustration. Yes.
no, no, you don't. You don't have a kid. You don't look like you're the age where you will have a kid. And you're talking about understanding my pain. The amount of efforts I've put in to raise Joshua, and he's such a wonderful kid. You cannot possibly understand the pain that I'm going through, doctor.
I think I do understand that what you're going through. It's a very hard time for a mother who has put in all her energy to get a child up to come to the stage and see him in this condition, which is a very emotional challenge you are going through, which we do understand. And we'll try our best to give him the best possible treatment and get him to a better state, which we are trying from our end. But it is our responsibility to let you and inform you that which condition and what is actually going on with his body and how is he responding to our treatment. So this is why we have to inform you, and I think you have to stay strong to make your child uh, and show like positive, make sure he's positive and you give him that support which he needs right now.
Just really upset. How do I make a complaint?
Complain.
Yeah, I'm not
uh,
happy with the care that we've been given in this hospital.
okay, so do you have any concerns, like particular concerns from your side based on the treatment or the based on the your
Yeah,
concerns?
I wasn't explained about anything that's going on, and out of the
Okay.
blue, you've informed me that my son has cancer and that
Okay.
he's about to die in 5 years.
Okay.
This isn't okay. This isn't all right. Okay, so your time's over.
Okay.
I want to hear your thoughts about how it went.
I thought you were good at the acting part. I appreciate your efforts.
I was trying my best.
Yeah, you were doing a good role. Like I was at
But
a point mesmerized by your part that I forgot what to speak.
in terms of your performance in the station, what did you think? What was your task?
Actually, this is like till now we have been doing only like the history part, the investigate part, and this is like the first time I'm doing a counseling, which I've never done in my life.
Okay,
So
it's good. I mean, you get
yeah,
an opportunity to improve.
yeah.
Okay,
So
but
like
but go on.
I think we don't know how to speak in a sensitive way is not been taught to us. How to make a sensitive professional talk is not taught to us is what I feel.
Yeah, I mean, I'm not blaming you. It's just that
Mm-hmm.
the way we've been taught how to
Yeah, true.
approach a patient, it's very insensitive.
Mm.
And the thing is, like, emotional, how you deal with emotions that, parents show or patients show is quite
Okay.
important. That
Yeah.
dealing with emotion, if you deal with an emotion well, then you instantly form a bond with the patient.
Yeah,
Whereas
true.
if you are unable to deal with patient's emotions, then it's very difficult for you to build a rapport with the patient. And
Yeah.
rapport is quite important. Rapport is so important to try and get more information from the patients and actually work as a team. So without a
Mm.
rapport, it's very difficult.
Mm.
Um, Now, I'm not trying to be rude to you
Mm.
or try be harsh to you, but
Mm.
this would have been a fail. The reason
Mm.
being, I just want you to try and go back to what your task was. Your task was to inform or break this. This is basically a breaking bad news.
Mm.
In your mind, you can categorize
Mm.
the 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 stations you get into
Mm.
various different categories. Like you mentioned, previous one you've done previously, the history taking ones,
Mm.
and those are pretty standard.
Yeah.
You're a
You
doctor,
know
someone
what to
comes with a
speak.
complaint. Yeah,
Mm-hmm.
so you know exactly how to proceed with that.
Mm-hmm.
Whereas this is a different bucket of stations, breaking bad news.
Okay.
So it comes under that, breaking bad news.
Mm.
And your task was to inform the parent of Joshua about
Mm.
the diagnosis.
Okay.
And at no point were you given information with regards to treatment of the patient. So that was like,
Yeah. Yeah.
you you know first thingy is first mistake that you made, and there's others as well,
Mm.
is the fact that you made up information by yourself. This
Mm-hmm.
was not something that was given to you in the clinical station.
Mm.
And in order to answer the patient's questions, you made up information, which
Mm.
is something that you should not do in any station. So this isn't just a breaking bad news specific information that I'm giving you. This is for any station.
Mm.
You cannot make up any information.
Okay.
You can only use information that is given to you in the clinical station itself,
Mm.
in the vignette, where
Mm.
the text part, or
Mm.
you can use information that the patient has given to you during the station. Apart from this,
Okay.
you cannot make up any other information. So that was the first thing.
Mm.
Second thing was, are you aware of, there's like a general approach to tackle any breaking bad news,
Mm.
and that is called spikes. There's a mnemonic,
Mm.
spikes. Okay, so
Mm.
S is for setting.
Mm.
Make sure that the setting is private, away from a busy corridor, things like that. And then second is perception of the person you're breaking bad news to. So like, what do you understand? This is something you did. You asked
Mm.
me, what my understanding was, so that was good. So perception is the second thing. After perception, then you basically give a introduction, or like a breaking, or like a, what do you call that, like a warning shot basically. So
Mm.
you're warning them that you've got some important information to
Mm.
share, or you've got something that's upsetting. An
Mm.
example is, I've got some very serious news. Can I share it with you, if it's okay with you? So yeah, try and get that invitation. Sorry, that,
Mm.
that was the mnemonic. So setting, perception, and invitation. So invite them, see if it's okay with them for you to share that news. And then finally, it is K is for knowledge. This is where you're giving that information to them, and the way you give this information to them is in chunks. You give a small chunk of information, because when you have someone dealing with this bad news and emotions, it's very difficult for them to remember the information. So give it to them in chunks always. Okay, so you give one chunk, you wait for the reaction, and you deal with the reaction, the emotional reaction. And if they've got any questions, you answer those questions. Then you give the next chunk. Then that's how you proceed.
Okay. Okay.
Okay, so it's step by step. And then once you have finished all that, then the last part is E is for empathize or deal with the emotions. So after you've given them the news, there will be some emotion. Obviously, you're giving them a bad news, so they will have a lot of emotions that they will have, and you need to deal with these emotions. This is another skill in and of itself. And then finally you've got summarize. Okay, so finally we've spoken about this. I know it's a lot to digest, but
Mm,
have a think about it. If you need any support, I'm here,
mm,
and then we can also arrange a follow-up meeting with you, and then you can summarize and then try and support at the end and finish the station. That okay. So this is how you do it. So what's the mnemonic? Spikes.
right.
Okay. Okay. All right. Now, what I'd like for you to do is just kind of go through the same station again and just kind of like work it through. You know, like try and redo it, but try and apply the things that I've taught you just now.
Oh, you want me to do it again? Okay.
Yeah, yeah. Just for you to practice and trying to get a
Okay.
feel
But
of
I have some
this.
doubts. Like you told me
Yeah.
not to take up the treatment part, but how can you explain the patient that we are doing our best to take care of the patient and save the patient to a good place, though he has the condition? Like how can we tell that part without?
Well, you made that assumption that the patient is being treated. In
Oh,
reality, the patient was not being treated. It's just that they got the diagnosis now, and
okay.
now after this, they were going to think about treatment. The
Okay.
conversation about treatment hasn't happened yet. That's why I'm.
Okay.
That's why I suggested do not
Don't
make
make up.
assumptions.
Okay.
Yeah,
Okay.
don't make assumptions. Okay, so actually take a minute and think
Mm,
about how you are going to approach this situation, knowing what
mm,
you know now.
okay.
You just take a minute and let me know when you're ready.
Can you tell the spikes full forms again?
Yeah, sure. So S is for setting.
Mm,
This is not possible for you to really change in a OSCE situation, but in real life, it's important. Then you've got perception,
mm,
where you check what their understanding is so
mm,
far, and you also check how much information they would like to get. Okay, and then second, I is for invitation.
mm,
So you get you invite them. Can I share you this? Can I share some information with you which could potentially be upsetting, or can I share some serious information, things like that. And then K is for knowledge, and
mm.
then and which you break in chunks. Okay, and then E is for empathy and emotions, so you deal with the emotions that they show. And then finally S is for summarize. Okay,
Okay.
and ending the consultation.
Mm, okay.
Okay, are you ready to start?
Yeah, sure.
Okay, wait, let me just turn the timer on for 8 minutes. All right, three, two, one, start. Hi, doctor. I just came once the nurse informed me that that you've got some results and you wanted to talk to me. What's happened?
Okay, so hello, I know you're Joshua's parent, so let me introduce myself. I'm Dr. Minshu, who is handling your son's case. So now, as you have got your son, we have. Are you aware of what your son has? Like what is happening?
No. Was I
Okay.
supposed to be?
No, I just wanted to know if you have an idea of what your son have or what is he going through. Uh, okay.
I mean, I was informed about the doctors doing a lot of tests on Joshua, but no
Okay.
one's really given me any clear explanation as to what's happening.
Okay. Okay, so okay, fine. Uh, now I will be going to explain to you what your son has and what his conditions are. Like your son had come with fever and bruising and fatigue to the hospital with all these symptoms, and uh, you are so we have done a lot of tests and investigations to come to the diagnosis of your son. So we have done bone marrow maps and molecular testing, and we have come to a diagnosis of AML, which is called acute myeloid leukemia. So are you aware of it, of what is the condition?
No, I mean, you're the first person to have mentioned this to me.
Okay, so it is a condition which is usually seen in younger age group, like your son. Uh, so it is a condition where young kids get leukemia infection, and he's prone to have immunocompromise and increased infection risk. So yeah, that is what your son has. Uh, did you?
I'm still not clear about what you're talking about. Is it?
Okay.
Like you mentioned, leukemia infection. Like, does he have an infection, or not sure what's happening?
Okay, it is usually a chromosomal disorder where your son has leukemia, which is decreased WBC, which is very important for controlling our body's infection, or which is going to fight our body's infection and all that. So since your son has that less, so he's more immunocompromised and more susceptible to infections. So which is a condition which has a little poor prognosis, of poor outcome, if you may understand. This disease doesn't have a good prognosis.
So he has an infection,
Yes.
and you're telling me that he might not be okay.
Yeah, so I'm telling you that this is a condition which is not going to, it has a lot of outcomes, so we will have to look out to it. So it is mostly, in all the cases we have seen, children who have this have a little poor prognosis, so who
What do
don't
you
have a
mean by
good,
little poor prognosis? I mean, can you be can you be more clear, please, doctor?
yeah. So your child might get through the condition or might not get through the condition. Uh,
What?
so we have.
What? What? Are you so he are you saying he will die? Are you saying
Uh,
Joshua will die?
Not
Doctor,
die.
that's what you told me, doctor. You told me he
Yeah,
will there's you don't
there's a
know if he'll be.
possibility of him. I understand your concerns. I know it's a very hard news to take. Um,
My poor Josh was gonna die. How long does he have, doctor?
the prognosis of this condition is 5 years. The survival rate is usually 5 years, but with good treatment and that we can see where it goes about.
Josh was supposed to be his best friend's best man at his wedding,
Yeah, I
and
understand your
he
concern.
won't even survive to be that. I thought he
I,
was completely okay. He bringing him to this hospital was a mistake.
no,
You
no,
you you
we
you
are.
guys you guys have just been doing all these tests on him. You haven't really been treating him. No one's given me any updates about what's happening.
Okay. No, it's a good thing you got him here because we have able to, because of those tests, we're able to diagnose him at a very good stage. And it's a good thing you got him here. And because of his diagnosis now, we can start our following treatment. So don't have to blame yourself. Um, we are we'll do our best to get
So is he
Joshua
going?
better.
Is so you saying is he going to be okay? Just
It's
I know doctors can like do a lot of things. They can do miracles basically. But is he going to be okay?
Yes, so like I said, it has a poor prognosis, and we will start his treatments and we will conduct all the follow-ups and look at Joshua, take care of him, has and look after his case and look at his prognosis. So once we get to treat him and get to know and we do follow-ups and we can look after him and we get to know his prognosis, where he's actually heading towards.
Okay,
But I think,
doctor. I
yeah, this,
I I'd like to be left alone for now, please.
yeah,
It's
I
just too
think
much
you
to
can,
take in.
yeah. I empathy you that it's going to be fine, but I think you have to stay strong for your kid. Um,
Okay. All right. Can we end the station here?
okay, yeah,
All right. In terms of like difference, did you notice anything?
yeah, little better talks.
You initially I think you had a bit of structure, but then at the end when I
Mm,
actually started, showing emotions, I kind
yeah,
of
I
got
got
the
scared.
feeling that you were not able to handle that.
Yeah, yeah, true.
Okay. And I was just trying to, see in what all directions I could push you. Initially you told me he's got 5 years prognosis. Then I did some more drama, and I got you to say that he was going to be okay.
Yeah, because it's hard to not like you have to tell he's in danger, but you can't tell him he's dying because that is so insensitive.
So,
So I
so
don't
what
know
do you
how to
have?
put it in
So what do you have? You've got uncertainty.
uncertainty. Yeah, how to
Yeah,
tell them,
yeah,
reassure them that you have to follow the treatment, but it's still going to be bad outcomes could be there.
yeah. So you basically do that. You are honest with the patient. You're not trying to
Mm.
give them a particular
Also,
sort of
yeah.
time frame. You don't
Mm.
know how long he's going to be,
Correct,
alive
correct.
for. All you can tell is, look, I cannot give you that time frame.
Mm.
No one can tell what
Mm.
it's going to be.
Mm.
But all I can say is that um, he's got he's got a severe medical condition, and it
Mm.
is going to take a lot in terms of treatment, but I cannot give you an estimate as to how long he's going to be alive for, or if he's going to die. I can't give you a an end result or an outcome that might happen. It's very
Yeah.
difficult to predict. So yeah, just be honest with them and give them that uncertainty. You cannot
Mm.
you cannot you can communicate the uncertainty, but
Mm.
what I'm saying is, in order to avoid the discomfort of communicating that uncertainty, don't give them false reassurances.
Yeah. But what do you
Yeah,
tell when patient is asking you think Joshua is going to die or Joshua is critically ill or like is he going to die? Like how do you answer to that? Because
we don't know.
mm.
It's a simple thing. We don't
Mm.
know at this point.
Mm. Okay,
That's
that's good.
that's an honest answer. Okay.
Mm. Mm.
All right. So I've got some notes. I've made some notes while I was doing the case. So you said, while you were referring to Joshua's case,
Mm.
patient is not a case.
Mm.
Okay, so
Mm.
you cannot be referring to, you'll score very low points if you talk to someone saying, your case.
Mm.
It's not the right way to do it. And
Okay.
then, in your structure itself, in the spikes structure, you did not invite me. You didn't ask, I've got some news to share with you.
So I
That
should
is
ask,
okay.
how do you invite someone? Like, should I ask, can I tell
Okay,
you?
so I've got some important news to share with you. Is that okay with you?
Okay.
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 And then while you were explaining the diagnosis, you used AML,
Mm.
acute myeloid leukemia, which increases the risk of infection. Like, I don't understand what you're saying. I can, as a doctor I can, but a general layperson will not be able to understand when you use AML or medical
But,
jargon, etc.
but in the stem, it was written AML, and it's our duty to tell the diagnosis to the patient, right?
Yeah. So in the STEM, they will give you the diagnosis, but your challenge is to make sure you're not using medical jargon. That means medical jargon
Yeah,
means,
the words
uh,
that patients don't
yeah,
understand.
yeah, patients would understand. So AML, acute myeloid leukemia, no one is going to understand.
Mm-hmm.
Instead,
Mm-hmm.
what I would do is I would say something like, so he's got blood cancer, which we call as
Okay.
AML. Okay, so that
Okay.
way it's clear. You're being clear, it's not an infection. Because when you were talking to me, I was getting confused, like, is this cancer, is it
Mm-hmm.
infection?
So basically,
So
tell them a simple one and then just mention AML in the end.
yeah, if you want to just say blood cancer, that's also fine, which we call AML. You don't have to mention that part even. Blood cancer, that's fine as well. And then I felt like, because of my reaction, you were trying to get rid of the emotional reaction. You were beating around the bush quite a lot. You were
Okay.
like, yeah, it's gonna be okay.
Yeah, because I don't
No,
know how to be like you told now you have to be truth and honest, which is not taught to us how to be.
yeah. So yeah, and I guess you were trying to get rid of my emotions. So that is also a reflection of you not being able to, handle or
Mm.
display your, empathy and that sort of
Yeah.
thing. That brings me to my next point, which was, you said, I empathize with you. You said I empathy you.
I was just following the spikes and I just saw empathy and I didn't know how to empathize.
Yeah. Okay, that's right. But you have to. you
I don't know
can't
how
be
to show that emotion of empathy like
you
in
can't be
words.
robot you can't robotic you can't be very robotic about it. In the actual station, things you
Mm,
can do is, when the patient starts crying,
mm,
take a tissue. I'm sure they would have kept a tissue on the table.
mm,
Take a tissue, hand it to the patient, and be silent. Let the patient, cry. And as they're crying, you can ask them, "Are you okay? Can I get you a glass of water? Would you like someone here to be with you to support you through this?" So
mm.
things like that. Okay, I
Okay.
can clearly see you're upset. Can I get you a glass of water? You know. So that's how you show empathy. You if you just say, "I am trying to show empathy to you," that's a very robotic form of showing empathy, and it will not get you any points. In fact, it'll deduct your
Okay.
points. Okay,
Okay.
so that's the
So that's how you
feedback
show
I've got for
empathy.
you.
Just like how you told is the way you show empathy, not the other way. Like
Yeah, like
when they're
you.
crying, like
So
you're real.
if
Mm,
someone's crying, then you basically label that. I can clearly see that you're upset.
mm,
Okay, I'll take a second here.
mm,
Would you like some water? Can I get you some water? Can I get you some tissues? So things like that. You're trying
mm,
to acknowledge that emotion, and you're trying to help them deal with it. Um, but you cannot try and get rid of the emotions by moving to the
using
consultation.
words.
You can't come back to the information sharing part and be like, even if I'm crying, you can't be like, oh, AML has poor prognosis, and the treatment is chemotherapy for this. If you keep telling me information, I will not be able to take it. I'm dealing with the emotion, so you're also supposed to stop and
Mm,
kind of acknowledge and deal with the
mm,
emotions with me. Okay.
okay.
Yeah, it was a difficult station, and I expect you to perform badly, you know,
Mm,
and don't feel upset about it. Use this as a learning opportunity. You're supposed to
yeah,
perform badly while you're learning, so that you
yeah,
are
yeah.
able to get better later on.
True, true.
Okay,
Mm, mm.
all right. Any thoughts you want to share?
No, thanks a lot. It was a good consultation, mock consultation.
Okay, no problem.